Hello everyone. In this class, we'll discuss about anemia and polycythemia. Anemia is a clinical condition characterized by decrease in oxygen carrying capacity of blood due to either decrease in the number of RBCs or their content of HB or both. There can be different gradings of anemia based on hemoglobin concentration. It can be mild anemia, moderate anemia, and severe anemia. It is mild anemia if the hemoglobin concentration is between 8 to 12 gram percent, moderate if between 5 to 8 gram percent, and severe if it is less than 5 gram percent. Some of the clinical features of anemia are there can be generalized weakness, tenderness, and fatigability, pallor of skin and mucous membrane. There can be respiratory symptoms like breathlessness, then serious manifestations like palpitation, tachycardia, and cardiac murmurs. The CNS features due to anemia are because of cerebral hypoxia like lethargy, headache, tinnitus, and confusion. Ocular manifestations could be there like visual disturbances, retinal hemorrhage. There can be gastrointestinal symptoms like anorexia, nausea, constipation, and there can be menstrual disturbances like amenorrhea, menorrhagia in females. And there can be renal involvement because of the decreased blood supply to the kidneys. BMR increases in severe anemia. So the classification of anemia, there can be morphological classification or etiological classification. Morphological classification is also called as Wintrow's classification, and it is based on the size and color of the RBC. That is, it is based on the mean corpuscular volume and mean corpuscular hemoglobin concentration. So thus, the anemia can be divided into different types: normocytic, normochromic, normocytic hypochromic, macrocytic normochromic, macrocytic hypochromic, microcytic normochromic, and microcytic hypochromic. There is a etiological classification which is also called as Whitby's classification, and this is based on the cause of anemia. The different causes are: the anemia could be because of hemorrhage, which is called as hemorrhagic. It occurs due to the blood loss, and hemolytic causes due to the destruction of RBC. Anemia is seen. Nutritional deficiency, the nutrition deficiency of proteins and minerals can lead to anemia. Aplastic anemia due to the decreased formation is another cause for the anemia. Pernicious anemia. Pernicious means destructive or injurious. The cause here is the lack of intrinsic factor. Consequently, there will be failure in the absorption of vitamin B12, and production of intrinsic factor is affected due to the atrophy of gastric mucosa. RBCs are macrocytic and normocytic. Excessive destruction of RBC produces mild hemolytic jaundice as well. The bone marrow becomes hyperplastic due to the increased hypoxic stimulation for erythropoiesis. The neurological disorders seen in extreme conditions, and that can be in the form of severe combined degeneration of the spinal cord. Reticulocyte response increases in number of reticulocytes after vitamin B12 therapy. This is due to the proliferation of the bone marrow, and numerous young RBCs pass into the circulation. Folic acid deficiency anemia. Anemia is megaloblastic as it is seen with vitamin B12 deficiency, but neurological disorders may not develop. Some of the causes for folic acid deficiency are less intake of dietary intake of folic acid, poor absorption, that is steatorrhea and sprue, where absorption defect is due to the lack of digestive enzymes and in part due to the folic acid deficiency. Another cause is increased demand as it occurs in pregnancy. Then administration of antifoliate drugs like some of the anti-cancer drugs or methotrexate, they lead to folic acid deficiency. Iron deficiency anemia. It's the most common nutritional deficiency disorder present throughout the world. Iron deficiency is the most common anemia in India. Iron deficiency anemia can be defined as any anemia which responds to adequate doses of iron. With long-standing severe anemia, thinning, flattening, and eventually spooning, that is cholinergia of the fingers of the nail, sometimes appears. So the causes for iron deficiency are decreased intake of the milk fed infants, increased loss of acute or chronic hemorrhage. Example, it can occur in worm infestation, peptic ulcer disease, piles, and increased menstrual blood loss. It can occur also because of the increase in the demand that which occurs in infancy, childhood, pregnancy, and menstruation. It occurs because of defective utilization due to the decreased absorption in disease of stomach and duodenum. Here are some of the difference of the etiological classification of anemia. In hemorrhagic anemia, it occurs due to the acute or chronic loss of the blood, and usually morphology will be normocytic, normochromic, and normocytic hypochromic. In hemolytic anemia, which occurs in hypersplenism and infections like malaria, drugs, poisons, which can affect the RBCs extracellularly, and where some of the congenital causes which are also can be acquired, which changes the shape of the RBC, can be sickle cell anemia, thalassemia, and hereditary spherocytosis. Here, the morphology would be normocytic, normochromic anemia. In sickle shape, the shape becomes sickle shaped, and in thalassemia, you'll be able to see microcytic hypochromic anemia. Then nutritional deficiency, where iron leads to microcytic hypochromic anemia, protein deficiency leads to macrocytic hypochromic anemia, vitamin B12 deficiency leads to macrocytic normochromic anemia, folic acid leads to macrocytic normochromic anemia. Then aplastic anemia, where there will be pancytopenia, that is decrease in RBCs, WBCs, platelets as well. It is caused by the X-ray radiation or bone marrow disorders. The morphology will be normal here. Effects of anemia on circulatory system. The viscosity of the blood depends on the blood concentration of the red blood cells. In severe anemia, the blood viscosity may fall as low as 1.5 times that of water. This decreases the resistance to blood flow in the peripheral blood vessels so that far greater than the normal quantities of blood flow through the tissues and return to the heart. This greatly increases the cardiac output. This is also called as hyperdynamic circulation. Hypoxia resulting from diminished transport of oxygen by the blood causes the peripheral tissue of the blood vessels to dilate, allowing further increase in the return of blood to the heart and increasing the cardiac output as to a still higher level. Thus, one of the major effects of anemia is greatly increased cardiac output and increased pumping workload on the heart. Reverse anemia occurs after gastrectomy because of the gastric secretion play important role in dissolving the iron, thereby permitting it to form soluble complexes with ascorbic acid and other substances that aids to its reduction to ferric form. This is very important for absorption of iron in the duodenum, even though only traces of iron absorption occurs in stomach. Polycythemia, abnormal increase in the RBC count is called as polycythemia. It is classified into primary or secondary type. In primary, which is also called as polycythemia vera or erythemia, erythremia, there will be increase in the RBC count more than 7 to 8 million cells per cubic millimeter. It may also be due to the neoplastic growth of the stem cell. In secondary polycythemia, RBC count increases up to 6 to 7 million per cubic millimeter. It occurs due to some disease of altered physiological state, for example, high altitude, which causes the rise in erythropoietin concentration due to the hypoxia. effect on circulatory system, cardiac output is not far from normal due to the balance between the increased viscosity of blood and greatly increased blood volume. Arterial pressure is also normal in most people with the polycythemia. In polycythemia vera, the skin becomes cyanotic. This is in brief between in brief about the anemia and polycythemia. Thank you.